Hey y'all, it's Jordan, Haley, and Kelly here, and welcome to Girlies with Degrees. Our goal here is to help PT students just like ourselves prepare to master the NPTE prep through breaking down board-style questions and then making the connections to evidence-based practice. So let's just get right on into it. We have a scenario here today. You have been asked to evaluate an 82-year-old female with a partial thickness wound on the left forearm. The patient reports that the wound occurred about 12 hours prior to consultation when she bumped into the armrest of her wheelchair getting back into bed. There is no longer any active bleeding at the wound site. So here's your question. Which of the following is not a physiological change involved in aging that makes older adults more vulnerable to integumentary injury and delayed healing? Here are your answer choices. A. Thinning of the subcutaneous fat layer leading to a higher risk of pressure ulcers. B. Disorganization of collagen fibers resulting in loss of strength and elasticity. C. Increase in sweat produced by glands that decreases the risk of overheating and heat strokes. Or D. Increased risk of shearing injuries due to epidermis and dermis thinning.
So, this style of question would fall underneath other systems on the NPTE. Questions within this section include diagnoses and conditions within the GI, metabolic, integumentary, and relevant signs and symptoms that would be associated with these conditions. It's kind of a catch-all for all the other random things that we might be needing to consider when we're seeing a patient and when we're in the clinic. So, if we were highlighting important info to consider when choosing the answer, it would kind of include the patient's age, the partial thickness wound. This kind of wound would break through the epidermis and some of the dermis, but it wouldn't go all the way through. The wound bed might be red and pink, demonstrating healthy tissue that just needs to heal up with due time. Another thing we might need to really consider is the mechanism of injury. This person bumped into the armrest around her house, and it wasn't too long ago. And then the last thing that's kind of important that we'd want to take a look at is that there is no active bleeding currently, which kind of makes sense because it occurred a little while ago with 12 hours. And so now we're kind of getting to the question stem. Which of the following is not a physiologic change involved in aging that makes older adults more vulnerable to integumentary injury and delayed healing? And so a key here to highlight is the word not. And why that's important is we're going to try to be reviewing the answer options and then having to consider and think to ourselves, would this happen with aging in the integumentary system or not? And so we're looking for an answer that's not matching up with what we know happens when the integumentary system is aging. So now let's break down the answer choices, and we'll be providing knowledge nuggets throughout the way to help you and that you can apply later. So the first option, A, thinning of subcutaneous fat layer leading to higher risk of pressure ulcers. Now, this answer choice seems pretty good because when we think about what we know about aging and the skin, it is pretty true. The subcutaneous fat layer thins, and this kind of results for that less padding over bony prominences, which can lead to a pressure injury. Additionally, this thing also impacts the use of topical medications and their absorption through the skin, as well as insulation. So some older adults might complain that they're really cold a lot and they might need to put on extra layers. And that could be because we know that this layer that's underneath the skin that usually is used to keep us warm is no longer there, or it's there in a much limited amount. Our next option is B, disorganization of collagen fibers resulting in loss of strength and elasticity. So when thinking about that comparison between what we know about aging in the integumentary system and what this answer option is providing us with, it sounds like this is pretty true. With age, new collagen is laid down in a slower fashion and also less organized, and this can result in poor integrity and elasticity. And so due to this, some of those risks are increased for skin lacerations, abrasions, shear injuries. And so that kind of matches what's going on here with this patient, is that she's bumped into something and now there's a new laceration, a new injury to the skin. And then our next answer is C, increased sweat production by glands that decrease the risk of overheating and heat strokes. Now, this answer choice is kind of interesting. When I'm thinking about comparing what I know and what we know about the changes of aging on the skin, it's important to remember that the sweat glands actually produce less sweat, and this will increase the risk of overheating and heat strokes in our older adults. So right now, with that comparison, it seems like the answer option is one to keep our eye on. And so we're going to do that. We're not going to throw it out, but we're also not going to discount it as we look at our answer D and see if maybe potentially that's a better option. So with D, increased risk of shearing injuries due to epidermis and dermis thinning. And so as we do that quick comparison, is this something that is actually happening as the skin ages, or it's not happening as the skin ages? This is true. The epidermis and the dermis interface will thin, and this is just like with the collagen, it's going to make the skin more fragile and prone to various injuries like abrasions, lacerations, cuts, shear injuries, and amongst other things. So we've kind of looked through each of our answer options, and we're getting pretty confident with what we think is the best answer. And I'm going to throw it over to Haley, who's going to present us with the best answer choice.
So after looking at the question and going through all the answer choices, our final answer is C, increase in sweat produced by glands that decreases risk of overheating and heat strokes. If you got this one right, congrats. And if you didn't, that's okay. We've got some places to learn. Sometimes these questions can get missed on the test because we don't spend a lot of time in these areas or these pathologies when we kind of get bogged down in the MSK, the neuro, and the giant cardiopulmonary content. For the NPTE, it's important to visit these other systems topics and to remember no matter who you're working with, the integumentary system is one of those things that you're going to be screening and taking note of during your exam for every patient. It's especially important when you are working with older adults due to all the age-related changes in their skin and increased risk of injury. Thank you guys so much for listening. We hope this question helped you guys out. Remember to subscribe to the podcast, stay learning, keep committed. Also, check out our integumentary issues cheat sheet that we added at the end of the episode in the notes for a quick, too long, didn't listen on this topic. Thanks again to everybody who tuned into this episode and for supporting Girlies with Degrees, and we will see you soon on our new episode.